Good evening, ladies and gentlemen. It's 7 p.m. on Saturday, June 6, 2020. We are getting started at the National Palace of Mexico in Mexico City. This is our daily press conference on the COVID-19 pandemic. We're going to share the daily technical report by Dr. Alomia and our dear colleague, Dr. Alexia de la Torre Rojas. She's here and she's the Director General to CENSIDA, the National ETS AIDS Foundation. She's an infectologist. She has formal training and broad experience in infection prevention. She has drafted several infection control protocols ever since the first issue in February, as well as other protocol updates. She's here today to talk about mouth masks. The WHO, the World Health Organization, published an interim guide about mask use in confined spaces. It's an interesting guideline because of the pros, the cons, and different constraints described in the protocol. These guidelines are aligned with our own mandate. What the WHO just published yesterday is exactly the same we've been telling you for days and months. So we are here to emphasize that the complex challenge of understanding that public health measures are not black or white. They're not yes or no. We would all like to have a simple formula, providing a practical solution where every single thing is useful and no element whatsoever has any limitations. Unfortunately, that's not the way it goes. So with this measure, as well as with other measures, as soon as the WHO disseminates this new guideline, when the information and the technical report differs from preconceived thoughts, everybody ends up thinking of these guidelines in terms of yes or no. So Dr. Alexia de la Torre is here to share key information about the potential advantages in using masks, but at certain times, in certain spaces, and under certain conditions. Nonetheless, it is not a solution for every single space. And there's no scientific evidence yet that widespread use at all times and by all individuals will have a significant impact in reducing transmission. That's not the way it is, at least as of today, June 6, 2020. If in the near future other scientific notions should arise, of course, we would end up updating this information. Dr. Alomia, please start your presentation of the technical report, and we will continue with Dr. de la Torre. Thank you, Subsecretary. Thank you, ladies and gentlemen. This is our 99th press conference. This is day 6 of the new normal. And you must always remember that 31 states of the country are in red. We shared the COVID-19 stoplight yesterday, and as we saw yesterday, every single state is still in red. Therefore, most social activities are suspended
con un mínimo aforo, con una mínima actividad, tener este tipo de acciones en el
Remember
color rojo.
that the indicators come in different colors, and if any indicator shows red, it means that you have to stay at home. For instance, for restaurants cannot start to work, and when they get started, they'll only be able to provide 50% of their services. Same thing, hotels that will only provide room service, for instance. Supermarkets can also have 25%, no, 50% capacity, and just one person per family is allowed. No groups are allowed, and inside the facilities, social distancing measures must be applied. The same thing for barbershops, beauty parlors. They can provide home services as long as the corresponding sanitary measures are taken. Parks and squares may have 25% occupation as long as people use the facilities or the areas to perform physical activities while the red stoplight is in effect. We must avoid crowds. No group activities or major congregations are allowed. Only individual physical activity is allowed. The rest of the services are suspended because we're still in the red traffic light. Only essential work-related activities are allowed, as per the currently published documents. Let's start with slide number 1. This is the international landscape. Few changes have taken place since yesterday. The 55.3% is sort of stable these past 4 days. As you can see, 55.3% of the cases have taken place in the Americas. The percentage has not yet increased, nor has it went down in the last 21 days. These are the figures for Mexico. Over 332,000 people have been tested. Some have tested positive to SARS-CoV-2, 113,619 cumulative cases, 170,434 negative cumulative cases is what we have. As you know, the active epidemic in Mexico only accounts for 17% of all cumulative cases. That is to say, 19,278 confirmed and active cases. The group that showed signs and symptoms in the past 14 days, they account for the active epidemic in the country. In this slide, we have an update of the cumulative burden of the disease. As the shade goes darker, it means that particular state has more cases. We have different ranges on the screen, and you can see most states are still below 3,000 cumulative cases. In this new slide, we show exactly the same information in a descending pattern, so you can clearly identify those states with most cumulative cases. In this slide, you can see the active epidemic, 19,278 active and confirmed cases. We see the same shades, the same colors on the map, and throughout the weeks, we will basically see the same colors, but they will have moved throughout the states because other states will reach peak levels while other states may have decreased activity. In this slide, you can detect those states with more activity as
transmisión importante en los
case
últimos 14
confirmations.
días, ya ahí
This
los
is
tenemos
the activity
representados en orden
throughout the
descendente.
last 14
La siguiente
days in
diapositiva es el mapa también
ascending
actualizado de
pattern.
la tasa de
This is
incidencia,
the
al igual que
updated
los mapas
map of the
anteriores, mientras más oscuro sea
incidence
el
of
color, quiere decir
cases
que la
throughout the
entidad
country,
se concentra
and the
una mayor
darker
tasa de
the
incidencia
tone,
y
you will
dado que
see the
esta
higher
tasa de incidencia se
incidence.
calcula en
And
base
since
poblacional, es decir,
incidence
por
is
100.000
calculated as
habitantes,
per
entonces estamos viendo
100,000
aquí una
people,
comparación
as per
de qué entidades
population
están teniendo
density,
mayor
this is a
transmisión
comparison
y
of
mayor
those
actividad reciente,
entities
sobre
with
todo en
more
zonas. Las que siguen en
transmission
color
and
más oscuro
improved
son las que están
activity.
contribuyendo
The
precisamente
states
a la
with the
epidemia
darker
activa
shade
en
are
México
contributing
con
to the
mayor
active
grado de
epidemic
transmisión.
in
Veamos
Mexico,
la siguiente
the higher
diapositiva. Es
transmission
esta misma
load.
información que
In
está
this
en
slide,
las
you can see
columnas
the
de color
same
verde
information in
y
the
en las
green
columnas
columns.
de color
And in
azul.
the blue
Tenemos la
columns,
misma tasa
you
de
will
incidencia
see the
acumulada, pero
same
como se encontraba
cumulative
hace 2 semanas
incidence, but
para
the
poder
way it was
hacer
2
la
weeks
comparación
ago,
en función
as
de
to
si
establish
está
a
disminuido,
baseline,
si esta
so
se
you can
mantiene
see
igual
if
o si esta
it
ha
has the
aumentado.
rates have gone
Eso nos daría un
down,
poco la
gone
perspectiva de
up,
cuál es la
or
actividad
if they
también de
remain stable. So
transmisión
you can
que está
also
sucediendo en
have
cada
a
una
transmission
de las entidades
perspective
federativas.
throughout the
Esto
different
lógicamente
states.
forma parte de
Of
la
course,
información
this
que
is
posterior a la
also
conferencia
part of the
se
information
provee y se
that
difunde
we
para que
provide
así
and
Pharma puedan
disseminate
ustedes ver
every
cada
single
una de las
day after
entidades y
our
ver
press
cuál ha sido
conferences
su
so you can
comportamiento en esta ventana.
compare the
Veamos la
behavior
siguiente
throughout the entities.
diapositiva. Son las
In this
13.511
slide,
lamentables defunciones que hasta el momento han ocurrido. Relacionadas con la
13,511
fecha en la cual ocurrió
deaths.
la
They
defunción
are
y
in
vemos todavía
date order,
1.189
and there
defunciones
are
que se
still
clasifican todavía como sospechosas
1,109
porque no ha sido
suspected
emitido su
deaths because
resultado de
the final
laboratorio y vemos
test,
también cómo estas
the
están
final lab test
distribuidas
has not
prácticamente en
have
los
not
últimos
been
20
released.
días
This
de la
is the
ocurrencia de las mismas.
distribution of the
Si vemos la siguiente
past 20
diapositiva,
days.
son también las
In the next
defunciones, ahora
slide, the
distribuidas por
deaths
entidad
are
federativa donde
distributed
ocurrieron.
as per
Siempre vemos
state
que el
where the
color
deaths
naranja
took
claro,
place.
que
In light
está
orange,
encima de las barras
on
azules,
top of the
va
blue
representando esa
bars, you
fracción
will
que
see
todavía puede
the
incrementar
fraction
el
that can
número de
still
defunciones en cada una de las
increase
entidades federativas, porque
by
son estas defunciones que
number
están
of
esperando el
deaths in the
resultado
different
de su
states
prueba de
because they're
laboratorio.
still awaiting
Veamos la
the
siguiente
lab
diapositiva,
tests.
que es
In
la
this
curva
slide, you
epidémica,
will see
tanto de
the
los casos
epidemic
confirmados
curve
como de los
of
casos que están
both
aún muy
confirmed
sospechosos.
cases and still
Continúa la tendencia
suspected cases.
ascendente, la
There's
hemos visto
still an
prácticamente
upward trend.
desde el inicio de
We've
la
seen it ever
epidemia.
since the
Y
epidemic
estos
started.
48.273
The
casos que aún son sospechosos, podemos
48,273
también verlos en la
suspect
siguiente
cases can
diapositiva,
also
pero
be
la
seen in
distribución
this other
por
slide,
entidad
but in this
federativa
case,
en
they are
donde están
distributed
presentes. En el color
state-wise.
rojo oscuro
And
guinda que está en la base son
cherry,
los casos
the,
confirmados que ya habíamos
the
visto en una
cherry
diapositiva previa,
represent the
pero ahora también
confirmed
tenemos
cases
entonces la
throughout the
barra
country,
naranja
but
claro
there's a light
encima de
orange
estos que
bar on top
representa
of the
la
cherry
cantidad de casos
bar
que aún son sospechosos.
representing
Y entonces, por
those
lo tanto, si
cases that are
nosotros
still
vemos las
suspected
barras
cases.
totales,
If you
pensamos que
add
al
up
menos la
the
mitad
total amount
de
of bars
de estos
and
casos que son
you
sospechosos pueden salir
observe that
positivos,
half of these
hay
suspected
estados que
cases
están en una
may
posición
end
de
up
carga acumulada
positive.
más abajo
They
que
may
otros, pero
test
que si su carga de
positive
sospechosos se
if
llega
the
a confirmar,
suspected
al menos en esta
burden is
proporción,
confirmed, at least
tranquilamente
in
pasarán
this
a unos
size
casos
of the
duales. Esta es un
population.
poco la idea
There may
de
be,
este gráfico, que podamos ver un
may
poco
end up
la magnitud más real
we
de lo que
may
está
end up with
sucediendo,
certain
no solo
shifts
viendo los
throughout
confirmados,
the
sino viendo a los
bars
duales,
because you
tanto de
must
los
not only
sospechosos y
analyze
además también
confirmed
podemos
cases,
saberlo
but the
dándole seguimiento
suspected
diario
cases as
a
well.
dónde se están
And daily
precisamente
follow-up
concentrando
must be
esta
provided
cantidad
to
de casos sospechosos que
understand
tienen aún
where
pendiente
suspected
un resultado de
cases
laboratorio. Si vemos la siguiente
are
diapositiva,
concentrated.
es también ya la
And this
acostumbrada
slide, well, this
diapositiva
is
de la
our
carga acumulada
usual
de
slide. It
enfermedad,
shows
en
the
donde el incremento
cumulative
de las últimas 24
curve.
horas fue ahora de
The
3.3%,
24-hour
representando
increase accounts for
3.593
23%,
casos nuevos en la
3,593
en
new
las últimas
cases in the
24 horas.
past
Son
24
casos que
hours.
se
All these
confirmaron o se
cases
capturó
were
su
confirmed
resultado positivo
and
en la
they
plataforma en las
were,
últimas
the
24
data
horas,
was
pero igual muchos de
entered
estos casos
in
iniciaron
the
con signos
platform
y
in the
síntomas
past
o son casos
24
de los
hours,
últimos
but
10
all
a
of these
15 días.
cases the onset of these cases started in the last 21 days. This is hospital occupation and availability. 95% was last night's daily cough. So out of the 22,663 IRAG total amount of beds for patients who do not yet require critical care, 12,584 beds remained available, while 10,079 beds are occupied. So we're talking about 43 to 45% increase in the number of occupied beds. You have to think about the fact that new people enter the hospital, as a lot of people are also released from the hospital. This is bed availability as per state. Mexico City, the state of Mexico, Guerrero rank in the top 3 places for occupation. And if you analyze how many beds have been retrofitted and how many beds are still available, availability remains open because the percentages throughout those entities is 21, 26, and 40%. So hospital bed demand is also increased in these areas as well as the supply. This is the availability of beds with a ventilator and dedicated staff. Both occupation and availability proportions remain the same. The same 3 states lead the list: the state of Mexico, Baja California, and Mexico City, and Guerrero in number 4. There's still availability of critical and general beds, even in the states with the higher hospital demand percentages. Finally, in this last slide, you can see the number of recently created COVID units. 2 more units were created yesterday, so there's a total amount of 791 COVID units. So we're not only providing services, healthcare services inside specialized hospitals, but new medical centers have also been created to provide healthcare services and specialized services to the population. The trend has gone up as the need for these types of beds. Thank you very much. Thank you, Dr. Jose Luis Alomia, Director General of Epidemic. Please, Dr. Alexa. Thank you very much. We're here today to talk about a vital topic. How can we protect ourselves? I'm here to talk about infection, prevention, and control. And today I'm here to talk about masks. As a reminder of the type of SARS-CoV-2 transmission, SARS-CoV-2 is the virus, and there are 2 types of transmission. The first type of transmission is via droplets. The droplets mentioned in several conferences are produced when you speak, when you cough, or when you sneeze. They weigh more than 5 micros. So right now that I'm talking, I'm generating droplets. They're falling beside me, but since I'm keeping safe distance, they don't come across you, they don't touch anybody. The droplets, for them to be really effective in terms of transmission, they require distance, they require closeness. This is why 6 inches or 1.5 meters is the limit set by the WHO. Another transmission mechanism is contact, contaminated surfaces. How long can the virus remain on a surface? It'll depend on different factors. It depends on the temperature, on the humidity, the porosity of the surface, and it can also say if these analyses are performed at the lab, and the tests have determined that the virus can remain from minutes to hours, but there's no direct transmission from our skin. I mean, we don't have any transmission mechanisms on our skin, but if I touch a certain surface and after that I rub my eyes, I touch my mouth or my nose, I will potentially bring the virus that used to be on that surface and bringing it directly to my body. How efficient is this transmission mechanism? There's still a lot to find out about the virus. We must remember that we're learning on a daily basis, but it's not such a strong transmission as the droplet transmission, but yes, most research currently done is focused on contact transmission. Certain clinics or have determined that using sprays is another mechanism of transmission. And you must remember that a specific type of mask, N95 respirators, are those we should all be using right now because they prevent passage of droplets. Transmission depends on several factors. If you only focus on droplet transmission, that will potentially require using a mask, we must take into account how many virus, if I'm an infected patient, how many virus will I be able to transmit? This is viral excretion, because not all individuals are capable of transmitting the same amount of virus. We have the super excretors. They excrete a higher viral load, and we cannot simply distinguish at first sight if one person will be a super excreter or not. So not all transmission is based upon the transmission risk. We all pose a different risk, and we are all vulnerable to different types of viral loads. In addition, we need to understand that the virus may not replicate in the very same way. There are research studies out there of viral excretion follow-up. I mean, excretion samples are taken at different days throughout the duration of the disease, and there are different viral numbers, viral loads over time. I mean, even a month after the onset of the symptoms, a person can still have a certain viral load. It doesn't mean that those viruses are necessarily still viral. Okay, so we have to analyze how to control the disease. When it comes to droplet transmission, we also have to focus on the symptoms. If I'm coughing, if I'm sneezing, it is more likely I will generate a larger amount of droplets. So if there's people around me, those droplets will touch the other individuals. And if I'm generating more droplets, the whole environment I'm living in will be contaminated with droplets. The evidence we have thus far is that this is a situation affecting people with respiratory disease. So if the droplets are inoculated sufficiently, it means that the viral load may be higher. But if we have asymptomatic individuals, because there will be individuals that never develop a symptom, other individuals may start excreting virus even before the onset of symptoms. So it generates anxiety because people start wondering, what if I start excreting viral particles tomorrow? Or what if I'm asymptomatic? What about how capable am I of contaminating others? I mean, the WHO includes two major studies in their guidelines because different factors must be studied and analyzed so we clearly understand if the methodology of a certain study was carried out properly. But one of these two studies tracked 91 contacts down, 91 individuals who were in contact with an asymptomatic patient. And none of the contacts developed the infection. So there were no secondary transmissions. This means that the potential for a pre-symptomatic or asymptomatic to transmit the virus is very low. In another study, the likelihood of transmission from an asymptomatic patient was less than 7%. This is why the WHO is calling for the development of further research studies so we can better study population health. Finally, the type of contact. The closest we are to others, the longer we remain in contact with another individual, it means that just because of the time of exposure to the droplets, the likelihood of getting infected will also be higher. The WHO's recommendations and guidelines is an update of the infection prevention guideline published in April. It is based upon three main pillars, three main recommendations for different types of populations. Number one, evidence provided for healthcare workers. It is key to have this information because the type of personal protection equipment or PPE will depend on their activities, their surroundings, the environment, and viral transmission. These elements are recommended both by our national guidelines and the WHO guidelines as to provide recommendations of the type of PPE our health workers should be using. Of course, it also depends on the type of exposure. If it's contact exposure, recommend gloves, long-sleeved robes. Both the Mexican guidelines and the WHO guidelines recommend them. The robes we end up, are not robes or full protection is not recommended because it does not increase the likelihood it does not increase the likelihood of getting infected. But when they are removed because they have a zipper or they have other mechanisms, when they take them off, if they're not properly trained, they may get contaminated. When it comes to droplet transmission, surgical masks are a key recommendation. Also, in the new update by the WHO, surgical masks in management areas. If there's a safe distance, they're not recommended by the WHO. Nonetheless, surgical masks in areas where social distancing is not possible, in those cases it is recommended. Aerosol or sprays are not present in every single area. But if I'm going to perform a bronchoscopy, if I'm going to intubate a patient or carry out an invasive procedure like dentists, when they carry out any type of activity with a drill or something like that, in those cases, spray is generated. So surgical masks, N95 masks are recommended. Eye masks or goggles are recommended to protect the eyes. As you can see, we're in alignment with the WHO. Our technical guidelines were published last month. We published infographics as well, specifying if social distancing is being complied with. And we must always remember that PPE use recommendation does not depend at all on the category. That is to say, if it's a nurse, a health worker, a cleaning person, or a social worker, it's going to be exactly the same, because all health workers are extremely valuable to provide proper care to the patient. Therefore, choosing the right PPE for a specific individual will depend on how they interact with the patient, with the environment, the type of procedure, and transmission mechanisms. An online training course was developed, and it shares the different specifications on when, how, and what PPE to use. We invite all health workers to take the online course. It includes continuous learning information. Let's talk about community use of masks. The community use needs to contemplate different factors. Community use if the person shows symptoms. It was published in February in our own guidelines. The recommendation is that if a person has respiratory symptoms, if that person cannot stay at home, for instance, when they go to the hospital, while commuting, while traveling to the hospital, they should use a mouth mask in order to protect everybody else. There's another group. When should the general population use a mask? If individuals don't have symptoms. So another key aspect that should be underlined about the guidelines and the WHO guideline update is that most recommendations come from experts. They're evidence-based recommendations. So once again, the research or being able to disseminate this information will help us to have much truthful information to protect us not only against SARS-CoV-2, but from other infections as well. We have to minimize the likelihood of community transmission. And we should also focus on the next pillar, which is close proximity. If I'm going to be in contact with a person who works at a market, for instance, and that person will have to deal with several customers, of course, that type of population is at a higher risk. These are the risk groups or individuals with a certain comorbidity. If they have to If they show any types of complications, they should go to the hospital, as well as the likelihood of keeping safe distancing. I think that it should be taken into account when we perform any activity where I'm going to do. And we should also think about how to implement and how to use the mouth mask. Among the updates, potential benefits of using a mask in a community according to the WHO guidelines shows a potential reduction of an individual's exposure before the onset of the symptoms. We already know the currently available evidence, but these are all recommendations of infectologists. There is a clear guideline. As long as the basic key measures are complied with for SARS-CoV-2, which is washing hands. Remember the contact, washing our hands, avoid touching our eyes, nose, and mouth, and keeping safe distance. This is key, and it should be contemplated as an additional measure, not as the only measure. The core, the pillar of prevention of these three measures. And another benefit I would like to mention about the potential social and economic reactivation to protect people who are currently protecting. And in the same guidelines, these are the potential risks of using masks throughout the community. This is once again the guidelines of the WHO, and the first is self-inoculation, self-contamination. When there's a foreign object on your face, you'll tend to try to touch it, to scratch your face, or to move the mask in an inadequate way. So if I didn't wash my hands before touching my mask, if I didn't wash my hands properly, there's a risk of self-inoculation. So if I'm keeping safe distance, I may be at a higher risk. The next is amplification. When you're wearing a mask and you leave it on for hours and they get moist, the humidity conditions may change and you may end up with a viral replication shift. You must remember how long a virus survives on a surface. It always depends on these factors. If I'm wearing a mask, if it's moist and I didn't change it, if I didn't take it on, instead of having just a few droplets that would have ended up falling with safe distancing, since I have the sensation of false security, they're just accumulated in the mask. There's also the people who are using the mouthpiece, and the risk of lesions may increase. Difficulty to communicate, which is important, as well as the elderly population, those who are using, those who believe this false sensation of safety. You know, there's nothing more dangerous than feeling that you're safe or at ease with an element that's not 100% effective at all if you don't add it up to the baseline efforts, and if you don't know how to properly use a mask. Finally, the environmental impact. We are all responsible for environmental health on behalf of the population. Next.
And we have different types of masks. It will depend, and this will be based on several research with several fabrics and with the opinion of the expert group of infections control regarding the factors that make a fabric cover might be more or less efficient for the general population. It is important to point out that there is evidence of research, clinical random trials, where the use of these fabric covers in hospitals environment increase the risk of infections for the health workers, for what we were mentioning. So these covers should not be used in hotels environments. This is only for community environments. The type of material, it is also important to consider polypropylene, cotton, depending on the layers, polyester cells, but after certain types, it won't have the capability to generate a factor of filter, an appropriate filter, and it will decrease quickly. It will generate, one of the factors is how much one can breathe using these covers and how much they filter the particles that we want to filter. The number of layers, they should have 3 layers. The combination of these materials, particularly in hospital centers environments, we always must have a layer resisting to the water of the external side. The shape, it should match the shape of the face. It should match the nose for those used in clinical environments and also in the community as well, and also the usage. And for the usage, we are going to have this exercise of how to use and the tips that we must have in our homes for the proper use of these covers, these masks. And the last element, which is fundamental, is we always must consider which ones are based on scientific evidence, the ways of transmission and the mechanisms of protections that we must follow. There's nothing more dangerous than use improperly the protection equipment everywhere, clinical service in the community, that verification and the proper use, the continuous training, the feedback of the people. It's a fundamental area in the control of infections. In this picture, you can see health personnel in an area of critical care area, and they are wearing a mask, eye mask, or goggles. And since they are in a critical area when there are sprays, here the use of ventilators is advised, the N95. You can see them with this white screen, but to be efficient, there must be a ceiling. It is published in our website for coronavirus. There are some adjustment tests, a specific guideline in terms of how to use these ventilators. And this means that it must be perfectly sealed, facial piercing, etc. It may interfere, even the makeup, it might interfere in the sealing of these ventilators. And below that ventilator, they have a chirurgical mask. And then this means that it was not properly sealed. That ventilator was not properly sealed, and therefore these people were exposed in this area of sprays under the belief that by using more, they would be more effective. But what we know is that the proper use must follow this verification process. So I have some masks because I think it's easier to do it than to explain it. And the first thing that clearly I would tell you, never go out without antibacterial gel. Remember that hand hygiene is the central line in the protection. We may not wear a mask as long as we can ensure that we can follow these characteristics of observing this safe distancing that we have mentioned so many times. But it is very feasible that I will touch my face or that I will touch different surfaces. So antibacterial gel, an important tip, check the concentration of alcohol in your bottles. It should have a concentration over 60%. Remember that ultimately it's a chemical product, so we must be very careful with our children to avoid they get in direct contact with this product with a proper supervision. Once I have my masks, I have them here in this plastic bag because I have noticed that it's often that people just put them in their purses or in the jacket, which clearly, if we are considering these transmission mechanisms and that I'm going to use them, wear them when I'm in proximity with someone, well, it's going to be contaminated potentially with this surface, and then I'm going to put it in my pocket, and then once I touch it with my hand looking for my keys, I have contaminated everything. And if I don't have gel, I may put my hands in my face and have this inoculation of the virus. So we clean our hands with this technique of the WHO, whatever technique you want, but the important thing is to cover the surface, the whole surface of your hands. This is important. And then I'm going to take my 3 types of masks. I have this mask KN95, this one, this KN95 or N95 or ventilators, etc. And the ones we can buy. It is important that since it is critical material, they must be approved by COFEPRIS. That's important. Now, we agree that these ventilators that you might find to a very expensive price, they are useful for the prevention of transmission of sprays. So in our community, we're not going to have sprays. In order this can be useful, they must have proper sealing. If they have proper sealing, you will feel like you cannot breathe. Actually, they will collapse once we inhalate. That's one of the tests for the adjustment. So it's senseless for people in their home place who are not conducting procedures with sprays or are not in places with sprays, clinical attention, clinical service. They don't need to use this type of masks. It is important to remind this because we have a scarcity of personal protection devices, and if we don't use them properly, the ones will not have this type of equipment is the health staff. And the health staff of the areas that require this type of protection, then again, you do not need that, not even in all the areas of the hospital, the areas where there are sprays. So I'm not going to use this one. Then we have these ones, this chirurgical mask. And sometimes there's a lot of controversy whether the white or the blue side. Truth be told, they come in different colors. And what we need to pay attention is, you can see that it has some folds. Where these folds point to? These folds, once we place the mask, they should not be pointing up. Because if they are pointing up, the drops, it is going to work as a nest, and our drops are going to stay there with a potential virus. So the white area has this thing pointing up, and then in the blue side, it's in this end. So this one, once I place it in my face, remember the hygiene on our hands, it has a nasal adjustment. So the important thing is that I should not touch the area that will be in contact with my nostrils and my nose and my mouth. So I'm going to place it, I will adjust it, and it has a nasal adjustment, and it's adjusted. It's comfortable, etc. Once I finish my activities in the area of care, and then I will remove it. Before removing it, the first things that I'm going to do, potentially I touch different surfaces and potentially my hands are contaminated. So quickly, but properly, I will conduct my technique for cleaning my hands. And then the thing that you must not do, and please notice this among your friends and people on the street, there's plenty of people that immediately they want to touch it and remove it from the frontal part. When they go to have lunch, they want to move it, and the first thing they do, they touch it. That's the worst, because this is the area that was exposed and it's contaminated, and I should not touch it. So I'm going to lean my hand, touch it by the strips, and remove it. That's it. This one is disposable one. So I should dispose of it. I will drop it in a bag, I close it, and then I will clean my hands again. So this is important. We must consider this. These masks should be used in the areas of clinical care. These masks only last for one shift, no more than 8 hours. And they should be changed every time they are wet or every time they are polluted. If it is wet, we should remove it immediately. And then we have our fabric masks. These fabric masks, we have different types of fabric, which we should choose those with a higher level of filter, and the mechanism is going to be the same one. Once I finish wearing my fabric mask, if I go to the mall and I'm not going to have safe distancing, or if I'm in the subway, or if I'm going to be in rich proximity to other people, let's consider an area that is polluted and an area that it was on my end. If I just scrap this and put it on my back, first of all, I already pollute myself. And if I scrub it, I also pollute the inside portion of the mask. And when I wear it again, I will take those viruses in the areas where they might create an infection. So what we should do is we fold it, and this way we can ensure that the internal area, which is the area that I will reuse, is protected. And I will place it in a plastic bag until the next time I have to use it, and I clean my hands. And the next time I'm going to use it, I will follow the same procedure. We must wash these ones on a daily basis. And it is important, if we have a washing machine, to use high temperatures so we can deactivate the virus. It will depend on the type of fabric, but it should be over 6 Celsius, and for other 120, depending on the type of fabric. And the other option is to boil them for a minute and then deactivate the virus using a solution with hypochlorite of sodium. But the problem here is the care of it, because if we disinfect and then we remove these products, what we might cause is toxicity for the person. We must deactivate the virus, but then we need to wash it, because otherwise what we will cause is to inhale these products, these toxic products, if we didn't clean them properly in the mask. And the most important, again, is that this mask by no reason will remove the lines of prevention of infection. And these pieces of advice are aligned with the strategies and the guidelines of this transition to new normal. Thank you so much. Thank you so much, Dr. Licio de la Torre, Director of Censida, for this wide and didactic explanation. So please, you go first. We have very little time. This is Sandra Aguilera from Grupo Comunicaciones. I just want to know, you didn't spoke about the neoprene masks, and I would also like to know if the mask should be used along with a full screen mask. Thank you so much. Yes, actually what we could do is we could create a quick guide of what are the fabrics and the characteristics to make it easier for the community and for you to have that information that didactic information so you know the characteristics that the fabrics must comply with. There are some fabrics that even with two layers increase the filter. The filter with this fabric mask, and that's why we still need a lot of research, goes from 0.7% of filtering and accuracy up to 60%. So you don't have the false idea that they will protect us the same that other areas. And the full masks, it's also an important question because it's one of the additional considerations by WHO, particularly for those people which we know that it's hard for them to properly use a fabric mask for a long period of time. These full cover masks are subject to contamination, and there is a specific procedure for the disinfection of these devices of personal protection. Thank you so much, Doctor. Olinka, you're next. Thank you, Olinka Valdez from Eje Central. My question is for Dr. Alomia. In the presentation, in the PowerPoint that you share, they present the percentage of beds with ventilators, but I would like to know how many beds are available, how many are occupied, and not only the percentage. And the second one is for you, Dr. Gactel. On May 14, they published an agreement to provide insurance to 1.6 million of health workers. That agreement is until April the 1st. But you mentioned that there are some workers or the family were not able to receive these benefits because they passed away before this agreement was approved. What are the options for the families of these workers? If these are workers from IMSS, is it considered a work risk, but they're only able to receive 60%? I'm talking about the without contracts or perks, and there are the families. And if we are foreseeing that this pandemic will last till October, this agreement with insurance companies, is it going to be valid? It is valid until August the 31st. Have they considered to increase this period of time? Thank you so much. Let me answer you. It's very simple. Yes, it would be advisable. This was a donation by the insurance companies via the Asociación Mexicana of Insurance Companies, AMIS, and it started with this scheme. However, it would be advisable if there were will by these companies to extend this period. The Minister of Finances will deal with this. He is the one who kindly found these possibilities. Regarding the retrospective, unfortunately, it is like it is. The nation will start with this condition of time, and those people without a contract, including the insurance service, are not eligible for this situation. Out of these people, how many won't be eligible to receive this insurance? I don't know this information, but we can present this once we have the information about health personnel, which is at the beginning of the week. Regarding the question of the figures for each one of the beds, we have from the medical center, we are able to know how many beds are busy or available, or for UCI, or are going to be available. We know the number for each one of the units, for the whole sector, for each municipality, for each state, etc. All this information is updated at REDIRAG. I am able to mention, based on REDIRAG, that yesterday the percentages that we present national-wise, we have 2,830 beds with ventilation, and 7,773 available. And these are distributed in each one of the states. For reasons of time, I'm not able to provide you each one of the figures, but those figures are available at REDIRAG. This network is for the operation, because the use of this network is not for the population. The use of this network is for the communication between the hospital units, when a hospital facility needs to refer a patient, or when an ambulance needs to commute a person, and know the capability, they will contact the CRUM, and the CRUM is the one monitoring this network so they can provide the access as soon as possible. Thank you so much, Dr. Carlos. We have 1 minute before the specialists leave. Here on the street, formal and informal business, there is something about the neoprene mask. Are they convenient or inconvenient? Which are sold, they are promoted as the best ones. Then again, it will depend on how many layers they have. I think it's important. There are different things we need to consider in terms of the fabric. One is the filter capability. One of these masks have the capability to allow you to breathe properly, including this type of fabrics, and some will depend of how feasible it is for them to filter the number of particles they should filter. This is for particles bigger than 5 microns. The piece of advice would be, if we increase the number of layers of this type of masks, we will increase the capability they have to filter. The fabric itself, depending on the fabric, it will depend the level of filtering, but this will increase depending on the number of layers. Clearly, we don't want half of a kilo mask because this will prevent us of breathing. So we must observe the capability of breathing, the capability of filtering, and we get an index. And this is based on the available research, which are limited, and based on the recommendations of the expert group of WHO. Thank you so much, Doctora de la Torre. So regarding mask, in conclusion, the new guideline of WHO sets a series of elements that show possible uses, possible benefits, and great limitations. Regarding what we have indicated in Mexico, nothing is changing because it's exactly what we have been telling, and it is within our guidelines since February. So whoever, if you want to use a mask, go ahead and use it, but consider that it is not an absolute barrier of protection. And if you don't use it properly, even it might work in your disadvantage because it might facilitate the contagion and the contagion of other people. This overall idea that mask equals solution, it is an idea not based on the scientific research, and it is fundamental to use the prevention instruments to have the direct information. We will use the site coronavirus.gov.mx. We will have there a very specific chart summarizing the possible usage for the mask, its benefits, and their big limitations. Thank you so much. Good evening.